Hi, Mr. Patient. So today we're going to use the Cavitron, or the ultrasonic scaler, which produces a lot of water, and it flushes, destroys, and removes bacteria from your pockets. And using this could make my procedure a lot shorter. If you experience any kind of pain or sensitivity, just raise your left hand and I'll stop. Because this instrument produces a lot of aerosols, I would like you to ask to rinse with hydrogen peroxide to reduce the amount of bacteria you have in your mouth. May I proceed? Yes, you can. You can proceed. Hello, so this is the Slim Straight Cavitron, or ultrasonic scaler. This one is used for moderate to light calculus and plaque biofilm. And then we also use a lower power setting for this. Now we're using the Cavitron to explore, and we're using exploratory strokes to detect the calculus. Now we are using the Cavitron. We go to the distal line angle, and then you want to open the blade up 15 degrees, and do quick strokes up to the distal and proximal contact, and then you want to bring the handle down and then up, and then you want to use the oblique orientation to do the vertical strokes. Now come back to the distal line angle, do overlapping strokes. Until you hit the mesial and proximal contact, bring the handle down, and then up, and then in the oblique orientation do vertical strokes. And then you would do the same for the 29. Go to the distal line angle, and then using overlapping strokes, go to the contact, drop the handle to oblique, and then do vertical strokes. Then go back to the distal line angle, all the way into the mesial contact, drop the handle, and then open to do the oblique stroke, or oblique orientation, and then the vertical stroke. There we go. Okay, now we're doing the linguals of 30. First, we're going to do some exploratory strokes. To detect some calculus. Okay, now we're going to start at the distal line angle, open the blade up 15 degrees, use continuous strokes until we hit the contact. You want to have an oblique orientation to do vertical strokes. Now start from the distal line angle again, doing continuous strokes until we hit the contact, and have an oblique orientation, and do vertical strokes. And then number 29, start from the distal line angle, do do overlapping strokes at 15 degrees until the contact. Go to oblique orientation to do vertical strokes. And then start at the distal line angle again, going mesial. Using overlapping strokes at 15 degrees until you hit the contact. And then orientate in an oblique fashion, and then use that to do vertical strokes. We're going to do 25-26. First, we're going to explore. See any calculus. This guy has clean teeth. Alright, now we start on 26 first. We enter the midline, open the blade 15 degrees, do continuous strokes until you hit the distal contact. Now drop the handle, and then go up, and then go the oblique orientation, doing vertical strokes. Go back to the midline, and then go mesial to the mesial contact, handle down, and then orientate obliquely, and then do vertical strokes. Now you want to do number 25, start from the midline, and then do overlapping strokes at 15-degree angle until the contact. Drop the handle, and then the obliques orientation, and then do vertical strokes, and then go back to the midline, and then go all the way to the mesial contact. Drop the handle, do the oblique orientation to do vertical strokes. Alright, we're going to do the linguals at 25 and 26. So first we're going to explore. Okay, now we're going to do Cavatron. I'm going to start from the midline and open the blade up 15 degrees. Then you want to do continuous strokes until you hit the mesial contact. And then you want to drop the handle and go up vertical oblique orientation, and then use vertical strokes. And then do the same thing on the distal side. So you want to start from the midline, do overlapping strokes until you hit the contact, then drop the handle, and then have an oblique orientation to do vertical strokes. And then same with 26, you want to start from the midline, and then overlapping strokes at a 15-degree angle, go to the contact, and then have an oblique orientation to do vertical strokes. Now to the distal side, start from the midline, and then go to the contact, have an oblique orientation, use the back, and do vertical strokes.